Insurance. He's going to talk to you a little bit about Medicare 101. He is wonderful at answering your questions. He's been here with us before, and we just really appreciate your time today and for being here for St. Francis and for all of you. So take it away.
Perfect. Thanks.
Thanks.
So as she said, my name is Dave Painter. David Painter, doesn't matter. She just asked. I've known her for like 4 years, and she just said, do you go by David or Dave? I said, I really don't care. You can call me either way. I am here today with the Ohio Department of Insurance. My division within the Department of Insurance is called OSHIIP, with a P. Very important when you say OSHIIP that you hit that P. You're going to get yourself in trouble otherwise. What it stands for is the Ohio Senior Health Insurance Information Program. We are one of 54 similar programs in the United States. All 50 states have one for U.S. territories. We are tasked with providing Medicare information to beneficiaries. That's our whole mission, right? We do it in a number of different ways. We have publications like the White Book that hopefully everyone has. Does anyone not have a White Book in front of them when they got there? Everybody's good? Okay. And I was telling the ladies I did bring plenty of extras. So if when I'm done you're like, boy, I want to grab one for whomever, please, feel free to do that. If you want to grab 1 or 10 for your friends, feel free to do it, okay? Publications like this, speakers like myself who go out and do these presentations. However, there are only 6 of us on staff who do these presentations. 6 of us, 88 counties. Another way to look at it, 6 of us for 2 million Ohioans who have Medicare. Every month we add 10 to 15,000 new people to Medicare for the first time, just in Ohio. That's just an Ohio stat. So I'm supposed to reach like 300 to 350,000 people a year. I'll be the first to admit I fall short of that goal. What we do instead is we train local volunteers. We have local people that go through our volunteer training. They learn to become OSHIIP volunteers, and they can help folks out with a lot of things. I'm going to mention as we go through here a couple things that OSHIIP volunteers can help out with. If you don't want to deal with us out of Columbus, we do have local people right in the area. We do have local people right here in the area. Speakers, volunteers, oh yeah. Website, it's on the front and back of this book. If you are online, insurance.ohio.gov. That is the website for the entire Department of Insurance, but when you get there, there's tabs at the top. One of them says Medicare Services. If you click that, you're on our page. Then we also have the hotline number. That number is on the front, the back, and literally every other page in this book at the bottom of the page. Can't lose it. 1-800-686-1578. Our hotline is manned 7:30 to 5 Monday through Friday. Actual human beings on the phone who speak English for their first and for almost all of them only language. They are all state employees through the Department of Insurance, so it's all impartial information. No one on our hotline has anything to sell, promote, or endorse to you whatsoever. We're 100% impartial, there to help with whatever issues you might be having with your Medicare and with your insurance product. So that's the commercial. Now let's actually dive into the book a little bit. Actually going to start out on page 3 in this book. And it says, what is Medicare? I think most of you folks know. Federal health insurance, right? Federal health insurance, 3 groups of people qualify. 65 and older, that's what we think of when we think of Medicare, 65 and older. Most Americans on Medicare, that's how they qualify for Medicare, is they're 65 and older. You can also be on Medicare at any age if you're disabled. And by disabled, I mean if you qualify for Social Security disability benefits. It's got to be through the Social Security Administration, but if you qualify for Social Security disability benefits for 2 years, after 24 months, you're then enrolled in Medicare, regardless of your age. The third condition there is any age and diagnosed with end-stage renal disease. End-stage renal disease is permanent kidney failure. Permanent kidney failure, there's a couple special rules you're going to see before we're done that has to do with that condition. But folks who are diagnosed with that can sign up for Medicare, again, regardless of their age. Regardless of their age. Then below that, there's a little graph here that says option 1, option 2. This is going to be the meat and potatoes of this whole talk this afternoon. Option 1, option 2. Everybody on Medicare, everybody is in one of those 2 categories. You're either over here in option 1, I have original Medicare, I may or may not have some sort of secondary coverage, hopefully I have a Part D plan, or over here in option 2, which is Medicare Advantage. Most of what we're going to do for the next 45 minutes or so is look at these individual pieces. What they are, how they work together or don't work together. What's coming right up is the Medicare open enrollment period. That's why we're back here every fall. October 15th to December 7th. That's that limited time. That's when you can make all your choices for how you want your coverage to be for next year. You make all your choices how you want it to be next year. If you want to switch plans, compare plans, that's your window of time to do it. Today, October 1, is the first day that they are allowed to start marketing to you. So if it hasn't happened yet, or maybe your mailman comes late, today's the day you're going to start getting ads in the mail. You're going to start getting ads in the mail, the commercials on TV, the radio. You're even going to probably get some pesky phone calls at home, you know, when you're trying to eat dinner. Because today is the first day they're legally allowed to start marketing that stuff to you. So just be prepared. It's the time of year when your mailman doesn't like you very much. All right, page 4. Applying for Medicare. With the exception of 1, 2, 3. Who's not on Medicare yet? 4. Oh, I got a bunch. Okay. Dang it, I got lucky this morning. I got to skip this whole page. All right. Applying for Medicare. So Medicare is still 65. Your full age for Social Security keeps creeping up, right? Keeps creeping up depending on when you were born. Your full age for Social Security might be 66, might be 67. Medicare is still 65. If at age 65, you're getting any sort of check at all from Social Security, whether that be on your work record, if you took early Social Security, your spouse, you know, disability, widows, widower, whatever it is. If you're getting any sort of benefit from Social Security, they're going to automatically sign you up for Medicare. Because they know when your birthday is if they're sending you a check. They're automatically going to do it. And I'm going to guess some of you folks who have Medicare, that's how the way it worked. The card just showed up, and you said, oh, I must have Medicare. I must have Medicare. That's how it works. For everybody else, if you're not getting a Social Security benefit at age 65, either because you know, you're still working or you're just delaying it to try to get the maximum benefit, you actually need to go sign up for Medicare. How do you sign up for Medicare? 2 ways to do it. You can do it online at medicare.gov. It's a pretty easy thing to do. It's a pretty easy application. If you don't want to do it online, you'd have to go to Social Security office in person to sign up. And I guess that would be, what, Findlay? Probably the closest one? Findlay or Fremont. So I know some folks go all the way to Fremont. So I need to do that in person. When do you sign up? There's a 7-month initial enrollment period. 7-month initial enrollment period. It's the 3 months before I turn 65, the month I turn 65, and the 3 months after. 7 months in there. We strongly recommend the 3 months before. The 3 months before. 2 reasons for that. Number 1, Medicare goes month to month. Medicare goes month to month. So, well, today's the 1st. That doesn't work very well. Let's say my birthday was October 30th. But I had signed up beforehand, and those 3 months before, my benefits would have started October 1. Even though in October 1, I really wasn't 65 yet. It goes month to month. The other reason, not that this has ever happened, but in case the government makes a mistake. Again, not that it's ever happened, but in case the government makes a mistake, if your card shows up and they made an error, and I've seen it all, I've seen numbers be wrong, I've seen names be wrong. I mean, I knew a guy, his name was Sam, and his card said Stephen. It happens. You want to have a little time to fix that before the first time you use the card. Does that make sense? So earlier is better. If, like me, you are a procrastinator, you do have the 3 months after your birthday to do it. You do have the 3 months after to do it. All right. Let's start talking about A and B. Starts on page 5. It's a lot of information for about 4 pages, so I'm going to kind of condense it down. So if you're really trying to follow along, you're going to get lost right now. I'll just warn you ahead of time. Regional Medicare is Medicare's Part A and Part B, right? If you have your red, white, and blue card, that's what you see. Medicare A says hospital, Medicare B says medical. What are we talking about there? A, you can think of it as inpatient stuff. Inpatient stuff. So it's your hospital insurance. It's inpatient in the hospital. Inpatient in a skilled nursing facility. Home health care, if I'm getting skilled care at home. And hospice care. Hospice is specialized end-of-life care. specialized end-of-life care, all covered under my Part A. My Part B is medical. You could also think of it as outpatient stuff. So now we're talking about the doctor's offices, preventative benefits, we'll see that here in a page or so. Durable medical equipment. Durable medical equipment is like walkers, wheelchairs, oxygen, diabetic supplies, CPAP machines, all that stuff that we sometimes need to keep us going. All covered under Part B. And then the last thing is outpatient services. Outpatient services simply means any services I'm getting at the hospital, but I'm not checking in. So ER, outpatient surgery, tests, x-rays, infusions. I'm doing it at the hospital, but I'm not doing it as an inpatient, is all covered under Part B. That was like 4 pages in like 30 seconds. Okay. Turn to page 8 for me. Page 8 has a whole list of preventative benefits. Whole list of preventative benefits. If you have Medicare Part B, you shouldn't be paying for these. I'm not going to go through this whole list in the time we have today. I do want to hit the very top, though, where it talks about shots. Talks about shots, and you see pneumonia, flu, and of course hepatitis. I want to talk about the flu shot, because it's that time of year again, isn't it? It's that time of year again. I already see as I drive around, everybody's got their signs up, flu shots available, flu shots available. If you have Medicare, you should not pay anything for a flu shot. Should be free. If you're getting it at your doctor's, the doctor will charge you an office visit, or can charge you an office visit. Particularly if you see the doctor, they will charge you an office visit. They won't charge you for the vaccine. If you're getting it at the health department, flu shot clinic, should be free. If you're going to one of the pharmacies, which is what most of us do, getting my flu shot at a pharmacy, it should be free. However, ask before you get the shot. Just simply say, hey, I'm on Medicare, this is free, right? And I haven't heard about it yet this year, but every so often one of the big chains will throw in an administrative fee, which basically means they're going to charge you $10 or $20 for something that's free. And you're an American citizen, you can choose to pay $20 for something that's free if you want to. That is your right as a citizen. I know what I would do if they're trying to charge me $20 for something that I know is free. So definitely ask. Should be free, but definitely ask before you get it. Look at page 9 for me. You see at the top of page 9, it says 2015 Medicare amounts. And you're saying, Dave, I came here to hear 2016 amounts, not 2015. Well, here's the deal. We don't know yet. We don't know what these costs are going to be for 2016 yet. Very interesting that last Sunday, Parade Magazine put out what they said were going to be the 2016 amounts. And what they put out was a rumor, but they reported it as fact. They reported it as fact. So there's going to be a lot of people running around saying, hey, it's going to go up X amount next year. Nobody knows that. Well, somebody knows it, but they're in Washington. They're not here. We don't know what it's going to be yet for next year. When will they announce next year prices? No. Earliest would be the end of this month. End of October would be the earliest. More likely, beginning of November. Most likely scenario, if they are raising any prices, after Election Day. And that's not even a joke. You guys are laughing? Mark my words. If they're going to raise it, they're not going to announce it until after we vote. But let's talk about what it is for this year. So we'll give you an idea what we're talking about. I'm looking at page 9, where it says Part A deductible. At this point, I'm thinking about someone who just has A and B. I don't have supplemental plan, I don't have Advantage, I just have original Medicare A and B. Going into the hospital, you would owe that amount. If I get admitted to the hospital, you would owe $1,260. Would cover you up to 60 days inpatient in the hospital. If you're there longer than 60 days, starting at day 61 through 90, you see there's a daily copay of $315 a day. Starting at day 91, there's a daily copay of $630 a day. But realistically speaking, how many people are in the hospital 60 days? Not very often, right? Not very often. Typically, you're in the hospital for a few days. If you're not able to go home, that's when you need to come to a skilled nursing facility, right? That's when we need to go to rehab or something like that. Under original Medicare rules say for Medicare to pay for a skilled nursing stay, you need to be inpatient in the hospital for 3 overnights, 3 midnights in the hospital. Inpatient, 3 midnights in the hospital for Medicare to pay for skilled nursing. Once upon a time, that was an easy thing to keep track of. If you've been in the hospital for 3 midnights, you've been in the hospital for 3 nights, right? Now the hospital has something called observation stays. Observation status, observation stays, I see heads nodding. What this is, you're in the hospital, you've spent the night, maybe you've spent a couple of nights. But according to the hospital, you're still an outpatient. You haven't been admitted yet. Haven't been admitted yet, you're still outpatient. Medicare's still covering you. This is part of that Part B, where I said outpatient services. You're still being covered. However, any night that you're there, that you're an outpatient, isn't going to count towards the 3 midnights you need. Doesn't count for those 3 midnights you need. How do I know if I'm inpatient or outpatient? Well, that's part of where it starts to get sticky. Some hospitals are really good at letting people know. Some aren't. It's kind of on us. And this isn't a Medicare specific thing. This applies to all of us. It's kind of on us to know our status. We have to ask. We're in the hospital. Ask for the social worker on duty. Hey, have I been admitted? Am I inpatient? Am I outpatient? And once you know, if I know that, hey, I'm an outpatient, I need to talk to my treating physicians and say, hey, I need my 3 midnights here. Anything you can do would be great, because I'm going to have to go to skilled nursing. My wife can't carry me around the house when I get home, It's important to know. It's important right now to talk to your loved ones about it. Because if you're the one in the hospital, you might be in no shape to be thinking about, am I inpatient, outpatient? You want to have someone else aware of it. And I do really strongly suggest talking to the doctors, because you would be amazed the number of doctors who have no idea about that 3 midnight rule. Absolutely, you would be amazed. Important to know. So let's say I got it. Got my 3 midnights, going to the skilled nursing facility. The first 20 days, first 20 days don't cost anything. First 20 days are free. Once I hit days 21 through 100, it's a daily copay of $157.50 a day for days 21 through 100. That's Part A, short version of Part A there. Part B. Part B, first of all, has a monthly premium, right? $104.90. Almost all Americans pay that Part B premium of $104.90. Is that going up next year? I don't know. Boy, y'all looked up when I said that. I don't know. I started out by saying I don't know. It stayed the same for 3 years. It has stayed the same amount for 3 years now. If I was a betting man, I know which way I would bet. I know which way I would bet, but I do not have any inside knowledge, nor does anyone else at this point, other than the people who make that decision. I said Washington, but they're actually in Baltimore. But they're the only ones who know for sure. It's probably in that budget, that temporary budget they just passed, if you want to take time to read all of that. It's probably a line in there somewhere, right? So $104.90 a month. I still have an annual deductible, $147. The first $147 coming out of your pocket. Once you've met that, your Part B is an 80-20. Medicare's paying 80% of the cost. You're left with that remaining 20%. You're left with that remaining 20%. The little thing down here at the bottom, this little chart, says if you make a whole bunch of money, you're paying more than $104.90. I'm going to alleviate most of your fears right now. If you are single, you can make up to $85,000 a year. If you are married, you can make up to $170,000 a year, and you're fine. You're not going to pay any more than that $104.90. If you're making more than that, you're going to pay a little more. Other than Kelly and Leanne, I don't think any of us have to worry about that. Yes, sir.
Toward the top of the page, what constitutes a work credit?
Oh, okay. He's talking about a Part A premium up here, and I normally go over it, and I'll tell you why I don't spend much time on that. It's talking about a Part A premium. 99% of Americans do not pay a premium for Part A. Here's how you got Part A premium free. You worked for 10 years throughout your entire lifespan and had Medicare taxes taken out of your check, or you had a spouse who worked 10 years throughout their entire lifespan and had Medicare taxes taken out of their check. Either way, you're good to go. Your Medicare is premium free. What they're talking about here with the work credits, think of it this way. You earn 4 work credits every year. So that's where I came up with 10 years. You can earn 4 credits a year because it's in quarters. So if I earned 40, then it's premium free, and then it moves on down. If I've had less than that, 7.5 years of work, then you start seeing the premium and lower than that. It's better than 99% of Americans get it premium free. This year we are talking to a lot of OPERS folks who say, hey, I'm in that other category, I didn't pay into it. And that's a specific OPERS thing that I'd be glad to address when we're all done, but I don't really want to muddy the waters just yet.
Yeah.
I don't want to muddy the waters just yet. Did that make sense? Yes? Okay. Okay. So looking at A and B, we saw there were a lot of deductibles, and then there was that 20% co-insurance, that 20% copay. A lot of people pay it. A lot of people say, I'm just going to take my chances. I'm not going to have anything. I'm just going to pay it out of pocket if I get sick, right? A lot of other people want something to fill in those gaps. Fill in those gaps and makes the difference. First way to do that is what we're looking at here on page 10 and 11, which is Medicare supplemental insurance. Medicare supplemental insurance, also known as Medigap insurance. Medicare supplemental, Medigap insurance is literally two terms for the exact same thing, just to make Medicare more confusing. There's no difference. It's the exact same thing. What this is a private insurance policy. So it's not the government at this point. It's a private insurance policy with a private company. If you choose to purchase one, you're paying them a premium every month. They're not cheap. State average is about $200 a month for one of these. In exchange for that, they're coming in after Medicare, and depending on the type of plan you have, covering most or all of what Medicare didn't cover. A lot of these plans are fully comprehensive. They're going to cover all those deductibles and all those copays, so you don't pay anything out of pocket. So you're not paying anything out of pocket. The plans are standardized. They're sold by letter name. So forget the A, B, C, D, the A, B that we already talked about. These plans are sold A, B, C, D, F, G, K, L, M, and N. Standardized means this. I'm going to use Plan F as an example. It's the best-selling one. That's why I use it as an example. A Plan F is the same thing, regardless who you purchase it from. Covers the same things, the same rate, regardless what company I buy it from. All Plan Gs are exactly the same, regardless who I buy it from. All Plan Ns, et cetera, et cetera. Every one of those plans, those letter names are the same, regardless who I purchase it from. All Plan Ns are the same, all Plan Ms are the same, all Plan Cs are the same. It's just the different, regardless what company I buy it from, it's the exact same policy. Only difference is what the companies charge for it. I can look at two Plan Fs, two different companies. I know it's the same policy. They're going to charge me two different premiums. How does that work? Well, the first thing I said about them is they're private companies. They're private companies. They charge what they think is a fair price. I always compare it to the car dealer and say you can go to two different Chevy dealers, look at the same car, all the same bells and whistles, and they're going to quote you two different prices on the car, right? Same thing with insurance companies. All the same bells and whistles, you're going to get quoted two different prices. You're going to get quoted two different prices. Nice thing about these plans, no network. I don't have to worry about is this doctor, is this hospital on network. I can go where I want. I know I'm covered. That's all over the U.S., and a lot of these plans even cover you overseas. Or I should say out of the country. I shouldn't necessarily say overseas, out of the country. I always say overseas, and I forget that, we can go to Canada, right? We don't have to get on a boat to go over out of the country. Cover you overseas. Very bottom talks about the right to buy. These are private insurance companies, okay? So it's not so much governed by the government as some of the other stuff we're going to talk about today. This guaranteed issue comes up 2 times. First time it comes up is the first 6 months that you are both age 65 and have started your Medicare Part B. I have to be both 85 and I have to have started Part B. 6 months. For those 6 months, I can sign up for any Medicare supplement plan offered in the state of Ohio at any time. They have to accept me as a client, and they can't do what's called medical underwriting. Medical underwriting is ask me medical questions and use that on my rate. They can't do it. I'm protected. Only other time that's going to come up is towards the bottom of this page. It says typically 63 days after loss of other coverage. That means anytime I lose my coverage through no fault of my own. Whether that be I've retired, I have a retirement plan like the OPERS folks that I've spoken to. My retirement plan is ending. the plan I was on before left Ohio, went out of business, went bankrupt. That never happens, but you know, in theory it could. I moved out of Ohio. I've moved into Ohio. You know, I've changed states. Then you also have this guaranteed issue for a period of time. But what that means is I can sign up for whatever I want, and they can't ask me anything. They can't ask me anything. Once you're outside of that guaranteed issue period, now they can ask you health questions. You can still apply for any plan you want at any time, but now they're going to want to know your whole health history. Some plans do a questionnaire, some send a nurse out to your home, some even go so far as to send you to a physical. They're going to know your whole history. And based on your health history, they're going to be able to say, no thank you, we don't want you as a client. Or, what's more likely to say, we're going to accept you as a client, but because of your health history, we're going to have to adjust those premiums. And they only adjust premiums in one direction.
No.
Correct. They only adjust premiums one way. Now, when I say that, I don't want to scare you guys off. I don't want to scare you guys off. I don't want you to hear that and say, well, boy, too late, I can't sign up for one of those. Keep in mind, they're in the business of insuring people 65 and older. That's all they do, is provide this for folks 65 and older. So, for lack of a better term, normal conditions aren't going to exclude you. Meaning, boy, I have high blood pressure, I have high cholesterol, I have fill in the blank. The reason I say that is you can't wait until something really catastrophic happens and say, boy, I better get one of these plans. You know, I've had a major, you know, heart incident, I've been diagnosed with cancer, or, you know, something really bad, and say, boy, I better get one of these supplement plans now, because then it's going to be too late. Then it's going to be too late. So good enough. Flipping the page for me. Two pieces of the puzzle down. Original Medicare A and B, secondary insurance that supplements. Some folks have them, some folks do not. But if I'm still over here in this option 1, I want to have some sort of a Medicare Part D. And Part D is prescriptions. There you go. Thank you for saying drugs. Everyone always says prescriptions. I always say D for drugs. It's the only one that makes any sense, right? D for drugs. Yeah, the drug plans. Everybody on Medicare can sign up for any drug plan sold in the state of Ohio. They're private companies, but they're under contract with Medicare, so they're not going to ask you any questions, they're not going to refuse you, anything like that. You can sign up for any one offer. This year, 2015, there's 31 to choose from. Next year, I think there's going to be like 35 to choose from. And I already see people like, oh my Lord, 35 plans? Yes, 35 plans to choose from. It's a lot of different plans. This open enrollment period is coming up, October 15th to December 7th. This is the time of year when you can compare your drug plan to the other plans that are out there. Figure out, is mine the best and for me, and if not, I can switch. Time to do that. You're not going to want to hear this, but I recommend, Department of Insurance recommends everybody review the drug plan every fall. We recommend doing it every single year. How the heck do I review 35 different drug plans, right? This is where we can come in. This is where we can help out. Give us a call on the hotline. You can do one of two things. You can say, hey, I want to compare my drug plans. I want to do it right now with you on the phone and have you mail me, you know, how my results come out. Or, I want to review my drug plans, but I want to find someone local that I can sit with. I want to find a local volunteer I can sit with. However you ask to do it, we're going to do the same thing. We're going to ask for your Medicare card and a list of your prescriptions. So we need to know the information on your Medicare card, and here's all of my prescription drugs, my dosage, and how often I take them. My dosage and how often I take them. If you get them all from one pharmacy, have the pharmacist print it off for you. Easiest way to do it. Have them print off. What we do is we take that information. We take your Medicare card and we look you up in Medicare.gov. Even if you've never touched a computer in your life, if you have Medicare, you have a profile on that site. You have a profile on that site. So that's why we need that information. We first look you up. Then we put in all those prescriptions, your prescriptions, and it's going to take those 35 plans and it's going to rank them 1 to 35 for you individually based on what you take. It'll tell us the premiums, and it'll tell us what the copays are on all of your drugs. It'll also tell us things like if your current plan is going up next year, we'll know that. If one of the drugs you take is not going to be covered by your plan next year, it'll tell us that. So we can look at all that, and there'll be no surprises. I'll put it to you that way. We can tell you in dollars and cents the difference between your current plan and some of the other plans out there. We can tell you what the least expensive plan is. What we cannot do, either staff or our volunteers, is pick for you. Can't make that decision for you. I can tell you in plain dollars and cents. We can be looking at plans and I can say, hey, it looks like the plan you're on right now, next year your total out-of-pocket costs are going to be about $400. There's this other plan out here that still meets all your needs. Looks like your out-of-pocket costs are going to be $200. I can tell you that 10 times. But at no point can I grab you and say, hey, you big dummy, sign up for the cheaper plan. And I wanted to. I had a guy last year who the difference between him sticking with his plan, and this is very extreme. That's why I'm using him as an example. The difference between his sticking with his same plan next year, which is what, when he left me, he was going to do, or switching was $20,000. And I could not get it through his head to switch. He said, well, it's worked pretty good so far. Well, really, it hadn't worked very good so far. So I don't know, maybe he had an extra 20 grand. I know I do not. I know I do not. So give us a call, one way or another. Give us a call on that. We'd be glad to help you out. If you can get you to turn to page 14 for me. Average cost, and these are updated for next year. These are updated for next year, for 2016. All these standalone drug plans, this is what goes with this option 1 that we're still talking about. They're all going to have a monthly premium. That's an average. You take those 35 and take the lowest and the highest, and they come up with that average. I think the lowest next year is 18 something. It's $18 and something a month for the premium. Goes all the way up to like 121, but most of them are in the $30 range. The majority of them are in the $30 range. Annual deductible, some plans have none at all. The most they can charge is $360, and that actually went up as well, of course. Once you've met your deductible, if there is one, how it's generally going to work is the plan's going to pay the majority and you're going to pay a percentage or a copay. Meaning a lot of times name brand drugs is a percentage. You know, the plan pays 75% of the cost, I'm left with paying 25%. A lot of times with generics, it's a flat copay. Might be $1, $4, $8, you know, something like that. Looking on page 14, the 4th bullet point down there where it says coverage gap. Got to spend a minute here. The coverage gap, otherwise known as the donut hole. Otherwise known as the donut hole. This is the only time in your life a donut hole is a bad thing, but this is a very bad thing. What this is when your total drug costs in a year, in a calendar year, all of your prescriptions, what you paid for your prescriptions and what your plan paid. When you hit this first amount down here, this $3,310, you have hit the donut hole. You're in this donut hole. You still have your Part D plan, but it wasn't working exactly like it was before. You're going to stay in the donut hole until one of two things happens. Either the year ends, because when we hit January, we're back at 0, starting all over again. Okay? When January comes around, you're back to 0, starting all over again. Or if you're really unfortunate, and you go all the way through and spend a total on drugs of $7,062. $7,062. If you spent that much on drugs, you've fallen in the donut hole, gone all the way through, and popped back out this other side. Once you pop back out this other side, now you're in what they call catastrophic coverage. Your copays are very low at that point, about 5%, because you spent a heck of a lot of money to get there. Spent a heck of a lot of money to get there. That's all the bad news about the donut hole. Here's the good news. It's going away. But it's going to take us 4 more years. In the year 2020, the donut hole will be gone completely. In the meantime, over the next 4 years, they're throwing in discounts for people who do hit that donut hole. And for next year, if you find yourself in the donut hole, any name brand drug you buy while you're in the donut hole, you'll get a 55% discount. So you'll be responsible for 45% of the cost. The plan picks up 55%. Any generic drug you buy, you'll get a 42% discount on. So again, you'd pay 58%, the plan would pay 42%. These discounts are going to increase every year over the next 4 years until finally in 2020 the donut hole's gone, hopefully never to be heard from again. Hopefully never to be heard from again. Page 15 again just talks about if you make that big money, over $85,000 or over $170,000 if you're married, you're going to pay a little bit more for your Part D as well. But there is one more thing I want to say about Part D before we move on to Advantage. Every year, I talk to a lot of folks who say, you know what, I don't need a Part D plan. I don't take any drugs, or everything I take is generic, I can get it at Kroger for $8, why would I sign up for one of these plans? There's two reasons that you need a Part D plan. Number one, every month that you're eligible for one and don't have one, you get a 1% penalty tacked on if you later sign up. So it's 12% a year. 12% a year, penalty never goes away. Never ever goes away. Now, if you have any other sort of prescription drug coverage that is called creditable coverage to Medicare, so that can be a current employer, a lot of retirement coverage that has drug coverage. If you're a veteran and you can get prescriptions through the VA, if you're retired military or a spouse of retired military through TRICARE, you never need a Part D. But everybody who doesn't have a drug plan who's on Medicare needs to have a Part D plan, or they're subject to that penalty. The other reason being, except for you folks, when you're new you can sign up for a drug plan, but beyond when you're brand new to Medicare, the only time you can sign up is October 15th to December 7th for the drug plan to start January 1. So let's say, I say, you know what, I don't take anything, the heck with it. I'm not going to sign up for this drug plan, I'm good to go. And then January rolls around or February rolls around and you go to the doctor and he says, you know what, Dave, you have this condition and I'm going to put you on this, 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 and this. Well, I can't sign up for a drug plan then. I can't sign up at that point. So my choices are either pay it all out of pocket if I can, or don't take it. And that's really my options. And that's why you need the drug plan. I use my father-in-law as an example for a lot of bad decisions. And he was fine because he had retirement insurance. However, when he was 66, up until he was 66, he always bragged that he took no prescriptions. And you guys know people like this. He always said, well, I've never met, everyone says they never met a 66-year-old who doesn't take any prescriptions. Well, he hadn't been to the doctor in over 30 years. And you guys know people like this, right? Then, of course, when he was 66, he had a heart attack. Then immediately, he was on blood thinners, blood pressure, cholesterol, diabetes, you name it. So he went from 0 medicines to like 8 pills a day, right? So that's why you need it. That's why you need it, because if you're in that situation and something like that happens, in April, May, you can't sign up for a plan at that point. You can't sign up at that point. All right, moving on to 16 for me. We're all the way through option 1. And I'm way further than halfway. You're starting to be like, oh my Lord, are we only at the halfway point? No, we're almost there. We're almost there. So with option 1, we had original Medicare, secondary insurance, Medicare Part D. A lot of folks are in that camp. A lot of folks are in this other camp, which is Medicare Advantage plans. Medicare Advantage plans, also called Part C. If you're wondering where the C went, you saw A, B, and D. What the heck happened to C? Those are Medicare Advantage plans. They're available to everyone. Well, actually, page 16 sort of has, here's the conditions. You have to have A and B. You have to have both parts of Medicare, Medicare A and Medicare B. You have to live within that plan's service area. In Ohio, it goes county by county, meaning the plans that I can sign up for in Seneca County, if I live in Seneca County, are not necessarily the same ones I could sign up for if I lived in Wood County. Depends on where you live, which plans you can sign up for. Doesn't mean that your doctors, your providers, your hospitals are limited to Seneca County. It means the actual plans I can sign up for are based on my zip code. They're based on the county I live in. And then the last question there, you cannot have end-stage renal disease. When I first started, and that's that permanent kidney failure again. I warned you it's going to come up again. I said you could sign up for Medicare prior to age 65 if you had end-stage renal disease. That's where they gave us something. Where they took it away is they said, however, those people can't sign up for an Advantage plan. But everybody else can. One of those weird rules, You can have anything else going wrong and you can sign up for one of these plans, but that one condition they exclude. Think about an Advantage plan as an alternative to original Medicare. So if I have an Advantage plan, it's a private company under contract with Medicare. I don't even need my red, white, and blue card anymore. That original Medicare card, don't throw it away because you still have it, but put it away. Put it somewhere where you keep important papers. Now you're just using your Advantage card. You go to the doctor, the hospital, the pharmacy, whatever it is, I'm using my Advantage card for all of that. It's an alternative to original Medicare. Two options, and they're kind of here towards about midway down page 16 there, the HMO and the PPO. And my gripe right now is there's no explanation on that page. When we reprint these books, that's what I'm going to get put in there, I hope. If someone listens to me, I'm going to get it put in there. HMO and PPO. HMO, Health Maintenance Organization. What that means is if your plan is an HMO, you have a network of doctors and hospitals that you have to use. Got to stay in network. If you go outside of your network, you're not covered. Got to stick with the doctors and hospitals in your network. The PPO, the Preferred Provider Organization, still have a network of doctors and hospitals. It's less expensive to stay in network. I'm going to pay the least amount if I'm in network, but I can go see doctors outside of network. I can go to any doctor. I'm just going to have a higher copay if I go outside of network. So I have a lot more freedom with the PPO. The HMO, only network, doctors and hospitals. The PPO, it's cheaper in network, but I can go see whomever I want. I'm just going to pay a little bit more. I'm going to pay a little bit more. Most of these plans have a Part D plan wrapped up right in them. As I said, it's an all-in-one package. I'm not going to have an Advantage plan and a separate drug plan. My Advantage plan is my drug plan. It's all going to be an all-in-one deal. The open enrollment for this is the same as the Part D. October 15th to December 7th. That's part of the reason why you get so bombed with ads right now, because this is the time of the year where they're trying to sell you everything they got. If you've never tried an Advantage plan and you're like, you know what, this is the year I'm going to check it out, open enrollment's time to sign up. If you got one, you're like, I want to get rid of this and go back to original Medicare, open enrollment's time to do that. If you have one and you just want to make sure it's the best one, time to do that as well, and we can help you with all of that. Again, give us a call. We can either do it over the phone or we can find you a local person. We can find you a local volunteer. We'll absolutely help you out. And in both of those cases, the Part D and the Advantage, we can actually, once the 15th rolls around, we can actually enroll you. We can disenroll you from plans you're in. We can take care of all that for you. And you don't have to deal directly with the insurance company. You don't have to deal directly with the insurance company. I will promise you, however, if you sign up for one of these plans through us, the next phone call you will get at home will be from the insurance company welcoming you. So I just warn people. You know, I've had people where we've sat and done it, and their cell phone starts ringing, and I say, don't answer that, that's the insurance company. They're welcoming you on board. And of course, they're also going to tell you about their other exciting products you might not know about. So that's why I say, don't answer it, let it go to voicemail. So those are Advantage. Option 1, Option 2. Before we go into the low-income programs, I want to back up a little bit. So what's a better way to go? Should I go with this Option 1 with the supplement and the Part D, or should I go with this Option 2 with an Advantage? I'm not ever going to answer what's a better way to go. You're not going to get that out of me, because it's not that easy of an answer. But I think about it in terms of money. Part B premium, $104.90, right? I said an average for one of these supplement plans is about $200 a month. So now I'm at $304.90. And an average for a Part D, we're going to say right around $30. So now I'm at $334.90 every month. A lot of money. But here's what you're getting for that. No bills. I go in the hospital. I go to skilled care. Go to doctors, specialists, whatever it is. My plan's picking that up at 100%. So regardless of what happens, I'm covered. What happens, I'm covered. Other side, the Option 2, the Advantage plans. Still pay my $104.90 for my Part B. Not getting out of that. Some of the HMOs have no premium at all. So all I'm paying is $104.90. Got my drugs through my Advantage plan. I'm good to go. Most of the PPOs do have a premium on them. They're substantially cheaper, like $50, $60, $70 a month. I'm just going to go with $50 to make my math easy for me. So now I'm looking at, with the Part B premium and the premium for the Advantage, about $154.90 a month. Not cheap, but a lot cheaper than the other way, right? The difference with the Advantage plans, though, is you're going to have co-pays as you use it. Meaning, family doctor, maybe you have a $20 copay. A specialist, maybe you have a $40 copay every time you go. You're going to have a copay in a hospital, a copay in a skilled nursing. So you're sort of going to pay as you go. So almost think of it as Option 1. I'm going to pay a lot of money up front. I'm going to know at the beginning of the year what my costs are, regardless what happens this year. With this Option 2, I'm going to pay less money, but I'm going to pay as I use it. I'm going to pay as I go. So it's almost like, are they going to get you coming or going, right? Are they going to get you coming or going? Okay, now looking at page 18 for me. 18 and 19 are both some low-income programs that I want to make you guys aware of. Page 18 is the Medicare savings programs. These are 3 programs that are run by the state of Ohio that can save you a lot of money. Again, they're for lower income folks. All 3 of them pay the $104.90. They pay the Part B premium. So if you qualify for any of these plans, you don't owe that Part B premium every month. They pay it for you. The lowest one there, the QMB, the Qualified Medicare Beneficiary, also works as a free supplement. So if I qualify for that, not only do I not pay my Part B premium, but I don't need a supplement plan either. It takes care of that. I'm going to talk about what these income levels mean here in a second. Page 19 is the low-income subsidy, better known as the extra help with prescription drugs. It sounds much better to say extra help, so that's what I prefer to do. Extra help. It's exactly what it sounds like. Helps pay for your prescriptions. If you qualify for one of these plans, you can get a Part D plan, you know, reduced or no premium, reduced or no deductible, low co-pays, no donut hole. You save a lot of money on drugs. We'll talk about the income levels here. Looking at page 19, where it says single person. Okay, where it says single person. It says you can have an income of less than $1,471 a month and total resources of less than $13,060. What they're talking about income, that $1,471 a month, less than. Income is monthly income, gross, Social Security, pension, wages if you're still working. That's your income, okay? And that's gross before anything comes out, before any taxes, Medicare, anything like that comes out. You can make up to that amount. And then you can see it's a little bit higher if you're a married couple, $1,991. Then total resources at $13,640. What counts as resources? The easiest way to think of it is money in the bank. Meaning, checking, savings, and any sort of investment money you have. You know, stocks, bonds, pension, or I should say IRA, not pension, IRAs, CDs, however you have your money. All going to count as resources. What does not count as a resource is your home, as long as you or your spouse live there. As long as you or your spouse live in your home, doesn't count as a resource. What's inside of your home is none of the government's business, so it does not count as a resource. Your vehicle doesn't count as a resource. If you have property other than your home, it will then count as a resource. It'll then count as a resource. Other thing to keep in mind with these is they do have a certain, they do have some wiggle room there. And a lot of people, where they qualify is if they have extra people who can qualify as dependents living in the home. Their official definition is, do they rely on you for more than 50% of their room and board or something like that, you know, and care. So, you know, if, you know, one of your kids moves their whole family back in and you can now count them as dependents, makes a big difference. Makes a big difference. A lot of grandparents have their grandkids these days, you know. Same thing. Count them as dependents. It's going to make a difference on this. If you think you qualify for any of this at all, call us and please do it right away. Do it today, do it tomorrow. It takes a couple months for these programs to kick in. So I don't want you to delay calling. We will help you with all these applications, and they're short. They're both, the Medicare Savings Plan is still a paper application. It's only 4 pages if you take out all the register for voting stuff. It's only 4 pages long. The extra help we can actually do online. We can do it over the phone while we're talking to you. And it's worth doing. People literally save thousands of dollars a year on these plans. If it's not you, you're looking at it saying, I don't qualify for that. Boy, I know somebody who probably does. You know, I have a relative or friend who I think might qualify. Grab another one of these books to give to them and say, hey, give OSHIIP a call and get signed up for this. You have nothing to lose. Nothing at all. It's all through either the state or the federal government, so they're not selling your name anywhere for applying. You're not getting penalized in any way. Very last back cover of the book. If you did not listen to a word I said, or more likely, by tomorrow you're going to forget 90% of what I said, and you say, I'm going to toss this in the garbage because I don't remember any of it, at the very least, hold on to the back cover. It's all hotlines, websites for you. For you. The very top is us again at OSHIIP, at Department of Insurance, 1-800-686-1578. We are 7:30 to 5. 7:30 a.m. to 5, Monday through Friday. Actual human beings who live in the same state as you and speak the same language you do. There to help you out. Any issues whatsoever. Next number down there is 1-800-MEDICARE. They are 24/7, 24 hours a day, 7 days a week. However, that is federal. So we share that same number with the entire country. Another way to look at it, you share it with 50 million fellow Americans who have Medicare. My advice, if you're calling 1-800-MEDICARE, early in the morning. Earlier the better. I've tried it at 5:30. That's when I typically get up. I get right through at 5:30. If you're a night owl, if you like any of the new guys, if you like Stephen Colbert, you know, you're up at 12:30, 1 o'clock, also a wonderful time to call. 3 o'clock Eastern Standard Time is a horrible time to call because everybody's up, right? It's 2 o'clock Central Time, 1 o'clock Mountain Time, and it's noon in California. Everybody's up. I promise you if we called them right now, we'd be on hold for a half an hour. So early in the morning is the best time to call. I always tell folks, you know, just get all your paperwork together when you're having that first cup of coffee in the morning. Best time to get through. A lot of other numbers there. You see Social Security. That Social Security number is, again, a federal number, but you can make an appointment at local offices. And you can specify where you want to go. You can say, I want to get an appointment, but I want it at Fremont. I don't want to go to Findlay. You know, and you can do that there as well. And a bunch of other information that's all there for you guys. But with that, I will stop talking and take questions.